Hey guys, Cassandra here. I will be doing my staff teaching on code sepsis. I know it's backwards for you all, but it says code sepsis and sepsis bundle. So when I did my clinical rotations, I would constantly hear throughout the hospital code sepsis on the medical floor, code sepsis in the OR. And to be quite honest, I didn't know what that meant. So if I didn't know what that meant, then I'm sure other people didn't know what it meant either. And so I'm going to go ahead and tell you what that means. So code sepsis is in the body's sepsis is the body's extreme response to an infection that can cause a life-threatening medical emergency. So it's an infection that you already have. It can be anywhere. It can be on the skin, the lungs, basically anywhere. And it's
Sorry. Come here, Logan. Get out of here. I'm sorry.
It's a chain reaction, or it triggers and causes a chain reaction. So without timely manner, treatment of sepsis can rapidly lead to tissue damage, organ damage, and fatality if not treated in a timely manner. So therefore, there's the diagnosis. Doctors diagnose sepsis using a number of physical findings such as fever, low blood pressure, increased heart rate, difficulty breathing. So doctors also perform lab tests that check for signs of infection or organ damage. Many signs and symptoms of sepsis, such as fever and difficulty breathing, are the same as in other conditions, making sepsis hard to diagnose in early stages. So, it can come off as just an infection, as most of us, when we get fever, then we don't really think much of it. We think, oh, maybe I just have like a little cold or some sort of infection that your body's trying to fight off on its own. But in this case, it's a little different because your body reacts differently, and it's a bad response to your body. So instead of, for example, so you come home and you left your favorite dish in the refrigerator, and it's been a long day and you're looking forward to eating this dinner that you left in the refrigerator, but you come home and your husband ate it. And instead of saying, oh, you know what, it's okay that you ate it, you get really angry and you start punching and throwing stuff. So that's kind of maybe an example of an extreme reaction that your body has of sepsis, instead of the very, very minimal, such as fever and other things that can be easily treated. So treatment includes giving antibiotics, maintaining blood pressure, blood flow to the organs, treating the source of infection, but it's also very crucial for time to be taken into consideration. So what is the CDC basically doing about this? The CDC is trying to understand the epidemiology of it. They're developing different tools for tracking sepsis. There is a hospital toolkit for adult sepsis surveillance, and you can find that on the CDC website. It is very informative. It's very lengthy. It's about 32 pages, but if you read through it, it clarifies the whole process of it and just basically what or how hospitals deal with a sepsis code. It even goes into how many days, a certain antibiotic is given. Also for the vasopressors, what vasopressors are used, what antibiotics are used once once they figure out what kind of infection it is, what kind of bacteria it is. Then they have different kinds of antibiotics that are used, the vasopressors, basically like epinephrine, norepinephrine, stuff like that. So, what else? I mean, they're also trying to promote early recognition for treatment of sepsis. So there's a Get Ahead of Sepsis educational page on the CDC that you can find. They're also collaborating with partners, clinical organizations, and consumer groups to improve antibiotic treatments and prescriptions and use. So that's what the CDC is basically doing about the whole situation when there's sepsis, when it involves sepsis. So my title also includes sepsis bundles, and I had no idea what a bundle is, so I'm sure there are other people that don't know what a bundle is. So basically a bundle is a short, straightforward set of evidence-based practice intended to improve the patient outcomes. Makes sense, right? And so there are different kinds of things that can change it, so you can do revisions on the bundles. Basically, the one for sepsis is a 1-hour bundle. It's initial resuscitation for sepsis and septic shock. So basically, the 1-hour bundle should be viewed as a quality improvement opportunity, trying to move forward on the ideal state. For critically ill patients with sepsis or septic shock, time is seriously or really of the essence. It encourages clinicians to act quickly, to obtain blood cultures, administer broad-spectrum antibiotics. That's after the blood cultures are taken. You would initiate the broad-spectrum antibiotics. Then you would then start with the fluid resuscitation, then measure the lactate level, and then begin the vasopressors. So that's basically what the 1-hour bundle includes. What else? Maybe in the hospitals you've seen the acronym DART, and most likely you just walk by it. So what DART basically is detection. So you would identify sepsis early, measure the lactate, and then that's for D. And then A would be ACT. You give 1 liter crystalloid bolus to start, and 30 cc's per kilogram target in an hour. And then you would start the antibiotics early, again the broad spectrum antibiotics, after the blood cultures are obtained. Then the T is for titrate, so you'd monitor the patient's response and then address the ongoing hypotension with the vasopressors. So I also have here, I'm not sure if you can see it, but right here, here's a brochure that I will upload as well. It's 4 ways to get ahead of sepsis. Basically, anyone can get an infection, and almost any infection can lead to sepsis. So you would, 1, prevent infections, take good care of chronic conditions, get recommended vaccines. 2, practice good hygiene, hand washing. Hand washing is extremely important. Keep cuts clean, covered until they are healed. 3, know the symptoms of sepsis. So confusion, disorientation, shortness of breath, high heart rate, as well as fever, extreme pain or discomfort, clammy or sweaty skin. And it's kind of hard because those symptoms can be confused with something else. So early detection is very hard, but it's crucial, and that's why everybody's trying to implement the sepsis code and how to detect it earlier. And then the 4th would be act fast. So sepsis is a medical emergency and time matters. So that's it for my staff teaching. So I hope you enjoyed it. Here, let me get a closer look of my board. Okay, thanks guys.